Hi everybody, this is Crypto Rich, working with you to get rich with crypto, filling our pockets with crypto profits. And in this video, I'm covering one of my pet subjects, which affects everybody who's in the crypto space, and that is to do with being healthy. How do you be healthy in the face of everything that's going on, and how to do it in a way that's cheap, safe, natural, and effective?
It's official. If you're using NordVPN, you're using the fastest VPN there is. It means you can secure all of your devices with robust encryption and enjoy blazing fast internet connection without the annoying buffering screen. Built on the incredibly lean architecture of WireGuard, it provides speed like no other protocol. Stay safe with the fastest VPN on the planet.
I have with me Dr. David Gimes and Dr. Gruff Davies, and I'll be introducing them both in a minute. And what we're going to be talking about in the first part of this video is vitamin D and health. How can, why is vitamin D so important? How can we get it? What difference does it make depending upon your skin tone? What's the value of it? How does it work? And then in the subsequent part of the video, which won't be on YouTube, we're going to be talking about vitamin D and a very topical current issue. And this is because of YouTube censorship, so please follow me on Twitter, CryptoRichYT, join my official Telegram announcements channel. You can also find me on BitTube.tv and Bitchute, and also Lbry and Odyssey, and those are censorship-resistant platforms. All right, David and Gruff, thank you so much for making yourselves available. Really, really appreciate this. I normally cover blockchain and cryptocurrencies, but every now and then I do a health video or a politics video, and I think this video is all health and maybe a little bit politics later on. Right, do one of you want to start by saying what you do?
We know nothing about crypto, so...
Well, I can come on your channel and you can interview me about
I'll have to watch the rest of the channel to learn about it.
That's right. Who wants to start introducing themselves?
Go on, David, I'll let you go.
Okay. Well, my name is David Gimes, and I'm an oldie. I qualified in medicine in 1966 at Manchester University. Trained for about 11 years in general internal medicine and gastroenterology. I was a consultant in Blackburn, East Lancashire, for about 40 years. I retired about 10 years ago now, I suppose it must have been. No, I stopped work 7 years ago, and I'm now 77. That's right.
Wow.
Feeling healthy, and I've been researching vitamin D for 30 years.
Right. Very good. And for those of you, because since most of my viewers are from the United States, what you need to know is that Dr. David Gimes is from Northern England, and that's a Northern English accent. Okay, not everybody in the UK speaks like the Queen or like they're from London. Thank you, David. Gruff?
So I'm Dr. Gareth Davies, but everybody calls me Gruff. It's my nickname. I am by training a medical physicist. I did a PhD in medical physics at Imperial in the late 80s, early 90s. And my interest in vitamin D came about probably about 2 years ago. I was diagnosed vitamin D deficient, and myself, on a routine blood test. And I was told to start taking vitamin D3 or cholecalciferol. And I tend to look into everything. So I started researching it and discovering that there was a vast body of scientific literature implicating it in almost all modern diseases, including dementia, hypertension, also diabetes, all sorts of things, skin diseases. And it was remarkable. It started me on a little journey of discovery. I'm an entrepreneur by day. I run 2 technology companies that have technologies based in AI and software. I've been a software engineer for the last 30 years. And I work with data, small data, big data, literally day in, day out. And as an experimental medical physicist with that level of data analysis background, when a certain event happened in March 2020 that affected everybody that we are not allowed to mention, I got stuck in and started looking at the data, and something struck me immediately. It was like seeing a color in a black and white picture, and I immediately saw that vitamin D was at cause in what was happening. So I got very, very involved in the vitamin D community. I've met some wonderful people, including David here, but hundreds of other scientists globally, scientists and doctors around the world. There's an informal alliance of us now, championing vitamin D as a message of health for everybody in the world. We have an open letter currently targeting health professionals and governments around the world, signed by some very, very influential scientists and doctors, very high-level expertise, many, many professors, and trying to educate the general public really about vitamin D, because it has had an unfortunate history. Really, it's first of all, it was labeled a vitamin when it was discovered in the 1920s, around the era that we were discovering other vitamins, and it fundamentally isn't a vitamin. So one of the criteria for vitamins is that they're vital amino acids, and it's not an amino acid for a start. And the other is that we can't produce it in our bodies. So you can't produce vitamin C, for example. Now, vitamin D we do produce in our bodies, except in winter. So we only produce it in strong sunlight. In summer or in the tropics, you can produce it all year round. But in winter, in the northern hemisphere, for example, between September and pretty much May, sometimes June, depending on what the weather's doing, you literally cannot produce vitamin D because the sun is too low in the sky, and the atmosphere absorbs all of the vitamin D as it travels through more atmosphere.
It's the UVB that doesn't get through. That's what we need, I understand.
Exactly.
Right? We need that when the sun is at its highest and hottest, without sunscreen.
Exactly.
I have been researching vitamin D for several years, and during the winter I take inordinate amounts of supplements, and in the summer I take extraordinary amounts of sunlight whenever I can.
Yeah.
Thank you, Gruff. David, anything you can say, just as a basic, so people can get an idea of what vitamin D is, what it does, why it's so important?
Well, one thing I might add is how I came across vitamin D, because that wasn't my specialty as a consultant in the hospital. That was gastroenterology, entirely different. And I was never trained in vitamin D. I was never taught about vitamin D. But it was when I was working in the northwest of England, in a city which has a large ethnic South Asian population, that we have one of the highest mortality rates in the country, quite remarkably so. Where I live now, in what's called the Ribble Valley, we have a standardized mortality ratio of about 90, which is below the national average. But 10 miles away in Blackburn, where I was working, the SMR was 130, 30% above the national average. And I thought, well, why is this? And the general explanation is because poor people, in particular, and it's a poor town, poor people eat the wrong food. And people in the northwest of England eat the wrong food. You know, it's their own fault. It's nothing to do with life in general. They bring the illness and short lifespan upon themselves. And so it goes also with even worse in the west of Scotland. And I didn't believe that. And so I started reading into it. And it was clearly not true. People tend to eat the same food no matter what part of England they live in, and also Scotland. So looking at it, I thought, well, why is this? Why have poor people, why have people without gardens to the houses, why have ethnic South Asian people, why do they have so much illness? And then it dawned on me that it's the lack of sun, it's the lack of vitamin D. Because we live in a part of the world which has about the worst climate of all. You know, looking out today, it's a grey day. We nearly always have grey skies. We have a few sunny days, not many of them, but we have to go on holiday to get the sun, basically. You know, you used to go to Blackpool, of course, at one time, then the south coast of England, and now Spain. But it dawned on me that it was all about vitamin D deficiency. And that's when my research started, and that is what it is. It's all vitamin D deficiency. People who have houses without gardens have lower vitamin D levels in the blood than people who live in houses like I do with gardens.
Yeah.
But on a beautiful sunny day, what do you do if you live in a little terraced house without a garden? And it struck me once, there's the odd person sitting on the front doorstep in the road in a chair, but everybody else was inside. And you find out the South Asian people, they're extensively covered with clothes, and they often don't, very rarely see them sunbathing. Now, it has been argued that white-skinned people in Europe, they have a genetic predisposition to taking the clothes off in the sunshine. You've got to take advantage of it. Because I live at the same latitude as Hudson Bay, the southern part of Hudson Bay in Canada, or Alaska, the same latitude of further north than anywhere in China, and the same latitude as Siberia. In the southern hemisphere, the latitude that I live on, 54 degrees north of the equator, at 54 degrees south, is uninhabitable. It's too cold. We're only able to live here because of the Gulf Stream. That's all. But the Gulf Stream, it does bring a lot of warm water, and that causes a lot of cloud and rain. So it's a bad place to live. And in the temperate zones, we don't do well in respect of health. So that's where I came from. If we want to improve public health in a place like the north of England, we have to do something about widespread vitamin D deficiency. When I was working, part of the research I did blood vitamin D levels on 1,500 South Asian people. It was 1,754 to be exact, and only 4 of them had a blood level of vitamin D which is in the ideal range. 4 out of 1,754.
And what is the ideal range, David?
Well, the ideal range, it's now realised, is between 40 and 60 nanograms per mil, which translates to 100 to 150 nanomoles per litre. Big problem. We've got 2 units, 2 measurement methods. So when we come up with a number, we've got to know what units that number happens to be. But if we take, say, 40 to 60 nanograms per mil, mine level is 60 nanograms per mil, which is 150 nanomoles per litre. Now, if you remember that 40, the average of those 1,754 South Asian people was 9.
Wow.
9 is staggeringly low.
That is.
Now, half of them had a blood level below 9. And the ideal, it's safe above 30, ideal between 40 and 60.
What year was this?
That was probably about 20 years ago I did that study.
Do you think the situation's improved since then?
I see no reason why it should have done.
Right.
No.
Behaviour hasn't changed.
And to address that over winter, well, over summer you have to sunbathe, and if you're averse to sunbathing for any reason, whether it's trying to avoid cancer or there's sometimes people don't want to go particularly dark skinned, and in a lot of Asian communities, especially in India, I believe there's a social stigma associated with being very dark skinned, which has to change. I mean, it's fundamentally involved in your immune system and being healthy, and we wear sunblock these days, so more clothes, we work indoors more, fewer people work outside in natural environment, and everybody, in fact, in the UK, regardless of skin colour, is deficient over winter. Everybody, unless they're taking adequate levels of supplements, which very few people used to. Hopefully more people are aware of that this year, thanks to our work. But it's almost impossible not to be deficient over winter unless you go on holiday or take supplements. And if you've got dark skin and you're naturally starting off at a lower level, you're going to be dangerously vitamin D deficient over winter.
It is. Those numbers I mentioned, that was all year round. I never divided them into summer and winter. I wish I had done. But I also studied 800 ethnic white people, and the average level there was only 18.
So still deficient.
9, but it's still deficient. That was all the year round. So you're quite right. It's impossible not to be deficient. Now, there are a couple of exceptions I did come across. I came across a man, a Bangladeshi man, who I thought must be deficient in vitamin D, and he had a very high level, better than mine even. And I couldn't understand this. I said, well, you don't go out in the sun a lot, do you? He said, no, he never goes. So what it turned out, he eats a lot of fish.
Right.
He said, well, what sort of fish do you eat? He said, I eat Bangladeshi fish. So what sort of fish are? He said, well, the Bangladeshi fish. I said, well, where do you get them from? He said, I get them from Tesco. So I went along to the local Tesco in Accrington, and there they were, packets frozen of Bangladeshi fish, and he was eating them 3 times a day.
Wow.
And he did really well.
Well, this is one of the observations early on in the pandemic. One of the observations early on in the
in spring 2020, right?
In spring 2020, when a thing happened, that really struck me. I started looking at the obvious latitude distribution of what was happening, and it was only happening above 30 degrees north on the latitude line. There was nothing severe happening below that mark, and there were two countries that looked very similar in terms of their latitude range and the size of the islands, and that was Italy and Japan. And we all know that Italy had fared very badly in spring, and Japan almost had no problem. And the difference between the two countries, Japan actually has twice the population density of Italy. It's about the same size in terms of land. If you ignore the lower islands, it's the same latitude. Twice as
elderly population as well. Very large elderly population.
Very, very old population, and yet they were just not having the same experience at all. And you can only explain so much of that with natural social distancing. They are more naturally social distant than the Italians, but there are twice as many of them in terms of population density. So, but the big difference is most of the Japanese population eat fish 3 times a day. It's one of the few diets in the world where people can get enough vitamin D, because you can't get it there's a little bit in meat, there's a little bit in eggs, there's a little bit in some fortified foods, but we stopped fortifying most foods in 1950. It was actually banned in Europe. We used to fortify foods between 1930 and 1950, and it was banned because of fears around vitamin D toxicity. It turned out those fears were unwarranted, because there was a genetic defect in some children that was assumed to be down to vitamin D deficiency, vitamin D toxicity, and it turned out not to be. It was something else. So it was banned for no reason.
Gruff, I'm going to come to the toxicity because I think that's important, because people have a lot of concerns about it.
Yeah.
I want to say, David, I have a cousin in London, very active, very fit, dark skin like me, outdoors, playing football, works in banking. He had his vitamin D levels checked at the end of summer, and they were 20 nanomoles per milliliter. 20.
Wow.
And this is someone who's young and active, plays football, cycles around. So completely
in the sun.
What you say.
In the sun.
In the sun, yeah, in London, where it's sunny and warmer than than Accrington or northwest England. Did you, when you discovered this, I mean, or have you at any point in your medical career started giving recommendations or prescriptions for vitamin D to your patients?
Yes, indeed. Oh yes, I was called Mr. Sunshine in the local newspapers. So everybody knew me and vitamin D. The message didn't get out generally because I wasn't involved in public health. I could only talk to people. But yes, I did an awful lot of prescribing of vitamin D.
And for what conditions, and what did you notice? What difference did you see it make?
Well, the trouble is, we don't see it making a great deal of difference. If people are very, very deficient, they can have skeletal problems, muscle pains, bone pains, and then you can see an immediate benefit. But these things are pretty rare. One of the diseases I dealt with to a large extent was Crohn's disease. And that was another thing that led me into vitamin D. And Crohn's disease is one of those long-term inflammatory diseases, which are erroneously called autoimmune. And the big thing there is vitamin D deficiency. Right. And there were some great improvements, but vitamin D wasn't the only treatment they had.
Yeah.
So it's impossible to see immediate benefits.
Yeah.
The greatest benefit of vitamin D, really, is extension of life. And this is one thing that came out during 2020, looking at doctors. And I looked at the doctors dying from a certain viral illness during 2020, and the obituaries appeared in the British Medical Journal. And there were 12 of them were white doctors with average age of death between, I think it was 79 and 106. And 13 of them were BAME doctors, average age of death between 52 and 72. The BAME doctors were dying 30 years younger than the white doctors.
Yeah.
Now, this isn't racism. This isn't poverty. This isn't living in small houses with no gardens. This is the difference between a white skin and a dark skin living not in the tropics, but living 54 degrees north of the equator. That's the difference. Yeah. So that's where you can find out how serious vitamin D deficiency is by looking at how long people live. Yeah. An average age 30 years younger. It was terrible.
Yep.
But it has no publicity. It is possible, Rich, that I am the only person in the country, even in the world, that knows about that, because that was my personal research during 2020. And right. I was the only person that to summarize it. This might be unique knowledge Unfortunately, they might take it to the grave with me before very long, but you never know.
No, I gotta
It's
say,
that serious.
I did notice that there were and BAME, if you're not from Britain and you're watching this, black and minority ethnic. So essentially, people in the UK, people from Africa, the Caribbean, India, Pakistan, Bangladesh, dark skinned people in these northern climes, BAME. So I did notice that there were these BAME doctors and nurses that were dying from the early part of 2020 to the middle part. And you know, there'd be articles in the Guardian and the British press, so it's all about poverty, and in the left wing press, poverty, poverty, poverty. And I'm thinking, no, because consultants aren't poor.
Yeah.
You know, an Indian consultant or a Jamaican consultant working in a hospital in the UK is not poor. It's vitamin D. And then, David, I've got a personal amusing story, which is, so I live in the southeast of England, and we get sunshine much more than you get in the northwest of England, right?
I can see that.
You can see that, right? My wife is fair-skinned. She's from Scotland, fair-skinned, dark hair. She will burn when it's 19 degrees and slightly cloudy. Right. And I'm just amazed by that. I never burn. She says, we go out, and then the following day she's burnt. What happened? It wasn't sunny. But there's something about I understand people evolved. As they moved north, we lost pigmentation in order to let the sunlight through so that we could make vitamin D. So we became fair-skinned and blue-eyed. And then because of post-Second World migration, you've got people like myself from warmer parts of the world, in this part of the world where there isn't sufficient sunshine. I have worked in Qatar. I've been in Pakistan in the height of the summer, 45, 50 degrees in the sun. I don't burn. I love it. I get hot, but I don't burn.
Absolutely.
And when I get hot, I go inside.
You've got nature's protection. And it's interesting that it evolved 2 billion years ago. Wow. Because 2 billion years ago, there's a formation of plankton. And plankton produce an oil called 7-DHC. Doesn't matter. 7-dehydrocholesterol, 7-DHC. Produces oil, and the sun breaks that oil down into what we now know as vitamin D. Well, vitamin D was just a byproduct. In the plankton, the 7-DHC did the same thing as melanin does in your skin. It protects against ultraviolet light. So vitamin D didn't do anything until fish evolved. And then fish started to eat plankton, and they took in vitamin D, and that allowed the development of immunity. That was 500 million years ago.
Is that why fish are rich in vitamin D then?
Because fish cannot produce vitamin D.
Right, I didn't know that.
Got thick scales. We were cutting a big sea bass in the kitchen the other day, and he's got great thick, tough skin. We're struggling to cut it with a sharp knife.
Which is why fish oil is so rich in vitamin D, and why fish liver is liver oil is so good for people. It's why it used to be given to kids. Cod liver oil.
That's right. Yeah. See, plankton produce vitamin D. Little fish eat plankton.
Yeah.
Big fish eat little fish. Yeah. And we eat big fish.
Yeah.
So that's how vitamin D gets into the food chain. There's only one way in which vitamin D can be produced. That's the action of ultraviolet light on 7-dehydrocholesterol, 7-DHC, which is produced in our skin just as in the plankton. Now, the interesting thing that not many people realise is when we get old, our skin becomes thin and dry. And if you've been in contact with people of 90, you know very well the skin is thin and dry. They do not produce this oil 7-DHC in the skin.
Right.
You can leave elderly people out in the skin out in the sun as long as you like. They cannot produce vitamin D because they don't produce the oil that the ultraviolet light creates, changes into vitamin D. So all old people are short of vitamin D, seriously short of vitamin D. The only way to deal with that is to give them vitamin D by mouth.
Right.
Or give them fish to eat 3 times a day.
Yeah. Like the Japanese.
Yeah, that's right, exactly. And like my friend with his Bangladeshi fish.
Yes.
And another guy I remember very well, he was a man with quite severe learning disabilities. He was in sheltered accommodation of some sort. He came to the hospital with his carer. And I thought that he must be deficient in vitamin D. And I couldn't believe it when he wasn't. He had a very high level. So when he came next time, I said, are you taking vitamin D tablets? And he looked at me blankly. And his carer said, no, he isn't. I said, well, do you eat a lot of fish? And his carer said, fish? I said, well, he doesn't eat fish, but he eats prawns. It's the only thing he'll eat. He eats prawn 3 times a day at least. So there we are. But
Okay,
but
now
if you want to get vitamin D without the sun, you've got to either take a supplement
we'll
or
come to the supplementation. We'll come to the supplementation. So, vitamin D being such an old nutrient would mean that it's so fully integrated into our metabolic processes and such an essential component of health, which I think, as a layperson, explains how come it has so many roles and functions. If you could just lay out what are the benefits. I know it's people with diabetes are low in vitamin D. You mentioned dementia. What are the major processes that vitamin D is involved in?
In the last 40 years, and David certainly knows more about the last 40 years of this than I do, but what I've learned in the last 2 years is that there's 40 years of recent scientific literature which shows that, for example, one thing people may not realize is that every cell in your body pretty much has something called a vitamin D receptor.